And just weeks ago, the White House issued a temporary pause on all announcements and communications from public health organizations. That includes the FDA and CDC. Well, that directive ended on February 1st, but it's still causing concern among some health experts about transparency around public health. Here's Jeremiah Beatty.
There's so much uncertainty that I think we kind of don't know where things are going to land.
Dr. Patrick Jackson, an assistant professor of infectious diseases with UVA Health, says many health leaders depend on agencies such as the CDC, FDA, and National Institute of Health to issue nationwide alerts. Under the White House's directive, all communication from public health agencies were halted until it was reviewed and approved by a presidential appointee. While most of these health sites are now back up and running, this banner still remains displayed on the CDC's website, warning users about new modifications under the directive.
And I think it is very important that we believe that the information coming out of the government scientific agencies is accurate, is not being edited for political purposes, and truly reflects reality.
This week, some lawmakers in Virginia sent a message urging White House officials to resume communication amid the recent outbreak of bird flu. While most bird flu cases were mild, Dr. Jackson says the White House directive could affect how researchers monitor future health trends.
And we really need to have active surveillance of what that situation is so that we have as much warning as possible to act.
Dr. Jackson says the FDA, CDC, and NIH have been trusted organizations that have done great work to advise the public of diseases on the rise.
I hope that we can get back to a place where things are more transparent, where there is clear communication. But right now, I think we just don't really know what's going on.
His best advice to the public is to pay attention to state and local health agencies. Jeremiah Beatty, 13 News Now.